Hello and welcome to our BCD Travel Talk. My name is Jelle Bamelis. I'm working at BCD Travel, and today we'll be discussing how to navigate a safe return to travel. Lucky for us, we have a very high esteemed guest, Dr. Lars Petersen from International SOS, and International SOS has been a long-standing partner of BCD Travel, also a solution partner of ours. But first and foremost, Dr. Petersen, nice to have you here. Can you give us, maybe, for people who are still unfamiliar with International SOS, a bit more explanation about what it is you do and maybe something more about your role within International SOS?
Yeah, sure, Jelle. So International SOS is a global medical and security assistance company. We have presence in around 90 countries around the world, and we are supporting our clients with medical and security issues when they are abroad, whether they're traveling or being expats or working on projects. We have a pretty substantial group of consultants, of which I'm part, which help our clients and support our clients, advise our clients on all medical and security issues. My role is, as I said, I'm being one of the consultants. I'm based in Amsterdam. I'm Norwegian from origin. My background is tropical medicine, so I'm specialized in tropical medicine and infectious diseases. Spent a number of years as a doctor in the bush, really, in Africa, and also worked as a general practitioner in the Netherlands and other countries. I've been with International SOS for 14 years, and I have a global role supporting some of our projects, and as I said, also being part of this consulting group.
You have some background in tropical diseases, so that gives you kind of, well, let's call it an expert view or a unique view about the pandemic, because the pandemic currently is still top of mind with a lot of our travel managers, with a lot of travelers as well. Could you give us an idea of where we stand today looking at the pandemic? Some people are hesitantly positive, talking about the end of the light of the tunnel. What's your expert opinion on the current status of the pandemic and how this will evolve in the short term?
As you've seen over the past 2 years, things are changing rapidly. A number of cases increasing and dropping, new variants coming up, and of course, Omicron is the best and most recent example. And it's been incredibly difficult to predict what is going to come next. And I think we are in the situation now where we say that predicting something beyond the next 2-3 weeks is almost impossible. The first response to Omicron was, of course, to close the borders to South Africa, and as we've seen with the rapidity of the spread, that doesn't really help at all. So it is an example, I think, of precautions being taken that do have no basis in the science. What we try to do is to gather the data, reliable data, from different sources, including our own presence in 90 countries, working closely with WHO, CDC, and other organizations, and to use those data, the science behind the outbreak, to advise our clients. At the moment, there seems to be some light at the end of the tunnel for part of the world, but we also know that the outbreak is fully alive and ongoing in other parts of the world, especially in the developing world, where very few have been vaccinated. So vaccination has played a major role in getting the case numbers down. But we also know that, like in Africa, only 10% of the population have been vaccinated. And that is, of course, a source of new outbreaks, new variants coming up. I think there's consensus in the medical community that there will be new variants coming up, and we don't really know what they will do. Will they become milder even than Omicron, or will they be different in terms of transmissibility, and severity of disease? So I think it's a mistake to say that the pandemic is over. because it's not. I think we're still in the middle of it. We are getting some breathing space now to kind of reflect on what has been happening and what we have been doing over the past 2 years, and to prepare for potential new waves. And I think what we'll see in the time to come is new vaccines being developed, vaccines being adopted to the newer strains of the viruses, as we see with the influenza vaccines, which are being adopted every year to the new influenza strains. And I think the same will happen with the COVID as well, that the vaccines will be adapted on an annual basis to be able to have the effect against new variants. I think that's going to be an ongoing and good, very good development.
Travel managers want to help their travelers to return to travel safely, even knowing that we might not be reaching the end of the pandemic yet. So what would you as an expert consider, or at least give some advice to them about the top priorities that they should have on the radar today and they should put into their travel policy?
I think what we've seen over the past 2 years is that different countries have taken different precautions at different times. Some are closing the borders, some are requesting vaccinations or testing or both, and it's changing very quickly. In quite a large number of cases, we're actually seeing changes occurring overnight. Governments are tightening the requirements for precautions before travel, and also quarantine requirements when you enter into the country. So I think the most important is to consistently monitor the situation, understand what is going on in the different countries around the world. The precautions taken by different countries are not always rational, not always based on science. A lot of it is based on politics or even wrong information. But we have to deal with it because that's what's happening, and I think that's the biggest limitations to travelers. Even today, you need much more preparation before you travel. You need to understand what the requirements are in the receiving country, what kind of vaccinations, testing, etc. There's also a huge amount of forms you need to fill in, travel locator forms, immigration forms, visas, things like that. And again, it's changing rapidly. And once you enter that country, and if you do test positive upon entrance, you might have to go into isolation in places you don't want to be in. And as we saw over the past weeks with Omicron, things are changing in your home country as well, so you might not be able to get home again after you travel. So it's incredibly important for travel managers, maybe, and that's changed the role a little bit. It's much more about monitoring the situation and understand where travelers are going to and what they need to do, and also look at, how essential are the travels. I think that is, changing our travel policies probably in the years to come.
So this extra layer of complexity for business travelers and travel managers dealing with this always changing travel restrictions, because that has been quite remarkable the past few years, and I think it's quite unprecedented. But we can say that about a lot of things these days. So you don't foresee any improvement in that situation when it comes to these measures, travel restrictions, testing, etc. How about testing, for instance? Do you think that's something that will stay part of travel modalities, of having to travel to different countries, having that getting tested?
I think so. I think so. I think testing is here to stay, certainly for the time being. A lot of airlines do require that you're being tested, even if you're vaccinated, before you travel, and a large number of countries do the same. So even if you're fully vaccinated, you still need to test yourself. So the testing landscape has changed, and we also know that there's different types of tests, and it's also about your own health. So we tend to take the easy way out and take the less risky test, but only to find out that we test positive on arrival and still have to go into quarantine. So you have the PCR test, which is highly reliable, and will detect even very low levels of viruses. And then you have the rapid antigen test, which is very popular because it's fast, it's cheap, easy to use. But we know that people who do not have symptoms, um, the rapid antigen test will only respond to about 30 to 50% of the positive cases.
Do you foresee any other health and safety measures becoming part of, let's call it, the new travel routine, like the QR codes, the face masks? We've heard a lot about face masks, for instance, becoming mandatory on airplanes for the upcoming years. So, what's your opinion on that?
We know that the air circulation in airplanes is very good, so the use of face masks is probably limited. Certainly also because if you look around in that plane and you see how people wear a face mask, you see a lot of them will wear them on the chins or under the nose, so not really efficient. So people wear it wrongly. They're touching the face mask all the time, pushing it up, pushing it down, which of course has the risk of getting virus on your hands, which you and then you start rubbing your eyes or picking your nose or whatever people do. And then of course in the middle of the flight, they serve food and drinks. And then all of us we remove the face mask. So the value of face mask in airplanes is disputable, I think, and it only works with a lot of other things we do if you wear it correctly and consistently. But yeah, it's there, and I think it'll probably take a long time before we get rid of the face masks in public transport and in planes. I think what is important is all the rules around hygiene, which is incredibly important, not only against COVID but other infectious diseases as well. And the last thing is the focus on good ventilation. As I said, it's already there in the planes. So incredibly good ventilation system, which is protecting us and filtering out around 99% of the viruses. But there's also much more attention now for good ventilation in offices and in homes as well, which is very important when it comes to prevention of infections.
Maybe the vaccination passports. I assume those as well. The QR codes that we are all familiar now. Do you maybe foresee an extension of those kind of QR codes? Because we know we have the little leaflets of the past, the passports for yellow fever, etc., vaccination proof. Do you think those might be expanded with other vaccinations as well?
Now that's a funny thing, of course, because compulsory vaccines for travel is not something new. You mentioned yellow fever when we had, the compulsory use of yellow fever vaccine, which in reality has been the only vaccine in the last years that has been compulsory in a number of countries. So making a vaccine compulsory is not something new. There's been a lot of debate, of course, around privacy. Are you allowed to ask vaccination status? But a lot of countries are less strict or have other rules when it comes to privacy than we have. And it's just a demand we have to deal with again. So if you want to travel, you just have to get your vaccinations. If you are against vaccinations or you cannot have them for any reasons, that might mean that you will not be able to travel because you will just be turned away at the gate or at the border. And again, different countries have different demands and requirements. And again, we need to be informed before we travel. I think that's the crucial role of the traveler himself, herself, of course, but also the travel managers.
What's maybe the top advice you can give to travel managers when they want to get their travelers back on the road safely and especially healthy?
Not only travel managers, but companies as a whole need to look at is the travel approval process, and in how far health issues should be part of that approval process. We know, for instance, among travelers that the major cause of death is cardiovascular incidents, and that has not changed with COVID. And so the first thing should be: is the traveler actually fit to undergo that travel. The second thing is, of course, has he taken the necessary precautions, which is vaccinations, and not only COVID, but all the other required or recommended vaccinations, and also things like malaria prophylaxis in African countries. So is the traveler fit to undergo the travel, and is that a part of the travel approval process? Another thing I want to mention is the consequences of the pandemic have been devastating in a lot of areas. One thing is that healthcare systems have collapsed in a lot of countries, even in Europe. A lot of people haven't received treatment. People with underlying chronic diseases, treatment has not been given, has been delayed or postponed entirely, causing increased number of serious complications and deaths. It will take a lot of countries around the world a long time to recover from that and rebuild healthcare systems that were already weak before COVID. So when you travel, it's something else to take into consideration, and you get something else. You have a car accident or you get a heart attack or whatever. There might be nowhere to go to.
Let's talk about an indirect, well, a direct consequence of the pandemic. We noticed a heightened focus, let's call it, on mental health. Does the travel manager or the company, what's the role they can play in that kind of mental health aspect? Because I think that's going to be a big challenge for the future as well.
Yeah, what we see now is that mental health is becoming a top priority on the agenda for a lot of multinational companies, and not only multinational companies. And it's a real issue. The number of cases of major significant depressions has increased globally with more than one third in the past year only. Same for anxiety disorders. We know that already before COVID, that mental health issues was important for a lot of companies. In Europe, we see at any given time that around 20% of the workforce is struggling with some kind of mental problems, small or large, which has a lot of effect on absenteeism, presenteeism, productivity. So that was already in place before COVID, and then of course, with the enormous increase in the number of cases we've seen over the past 2 years, it's becoming more and more relevant.
And how do you advise organizations to deal with that?
Having a for a mental health policy in place is not an easy thing. We sometimes jokingly refer to it as a yoga and yogurt culture, where companies have some yogurt in the fridge and a yoga class once a month. But that's not a mental health program. It has to be broadly supported in the organization. It has to be broadly supported from the leadership. You have to understand what the problems are. So you have to, do some kind of base survey to understand what the actual situation is in your company or your industry, and then you can start developing targeted intervention, which again has to be linked to culture, to different ways of living. Some African countries don't even have a word for depression. Doesn't mean that there's no depression. You have to develop a culture, which is not easy, of openness, that the company shows that they are willing to talk about things, that take it seriously, stimulate employees to talk to the colleagues, to flag it, so that you have somebody you can trust, you can talk to, and the company is being willing to deal with it in a serious way. But a recent survey we did amongst our clients, global clients, we see that only 35% of the clients actually do have, these kind of programs in place. So it's still a lot of work to be done.
We talked quite about the COVID, the return to travel, but are the travelers, in your opinion, willing to travel again? Are they motivated to go on a business trip? And if not, is there something that travel managers can do to boost that confidence again?
We did a survey a few months back where we saw among our clients that 80 to 90% are very keen to get back to traveling again. So people want to travel, and again, people have been locked up in their homes, working from home. So people do want to get out. They do want to travel again. They want to resume normal life, which I think is, more understandable. So the willingness is there, but on the other hand, when it comes down to it, how many are actually wanting to step on the plane again, and we see reluctance there. So that is another challenge we're facing. How do we get people back to work again?
What could travel managers do to boost the confidence of those travelers who will need to travel?
I think the key is reliable information and communication of that information. I think that's where it all starts with. One of the big threats we see to getting this current pandemic under control is all the misinformation and disinformation. I think it's incredibly important that organizations have access to the right information, to the reliable, objective information, and also share that with the employees. And if you can do that and then offer the right support when it comes to access to vaccinations, taking care of the travelers while they are away.
If we put the pandemic aside for a moment and we think about other risks, travel risk, but especially on the long term, but climate change is also a big challenge that as a whole world we face in the near future. How can travel managers anticipate those things as well? Because those will probably as well have big changes or big impacts.
There's a number of things you can anticipate on. There is a hurricane season in Caribbean, Latin America, and south part of the United States, somewhere in August, September. Air pollution in China, very seasonal influenced, amongst others by the annual forest fires in Indonesia. So, something you really need to think about. Do you really want to send your asthmatic patient into that area when the air pollution is at its worst? So there are things they're present, but you can anticipate and you can take the right precautions again. Same goes for security, which is not only my real expertise, but we as a company offer security services and analysis. And if you look at what's happening in Ukraine now, that's something we've seen coming for the past weeks. We always warn around election times in a lot of countries, because that's always time for social unrest and sometimes civil wars, or sometimes worse. So again, there's a lot of these bigger themes you can anticipate on and you can plan for. So I think again that's all about a proper risk, and in my case health risk assessment before you travel on the locations you're traveling to, and planning around that. And we believe that proper risk assessment, both on the health and security side, should be an integrated part of your travel policy.
Yeah. And looking at the recent developments, I think it'll be key moving forward the next few years and into the future. Absolutely. So my biggest takeaways, and correct me if I'm wrong, today is that communication is a very big part. Planning is a very big part as well. And that's things that International SOS can also help our clients with, right?
Absolutely, and I think one of the things we did when COVID broke out already in January 2020, we opened a website with reliable information on the outbreak. Mm-hmm. So I think access to the correct information, as I said, reliable and objective information on what's happening, the science behind it, and then awareness and communication to employees. I think that's absolutely the most
foundation
element. Yeah.
Perfect. Thank you very much for giving us some of your time today. We will have a link available for people watching this BCD Travel Talk, so they can ask questions to you directly, etc. Thank you very much for your time.
You're welcome.
And I wish you a very happy and especially safe afternoon.
Thank you.